So first of all, whenever I see someone who is pregnant, I'm like, wow, okay, how did I survive that thing?
PPH is one of the number one mother killers in the world. Unfortunately, it's still so in Malaysia as well. There will be blood loss during childbirth, but it's the amount that matters. So to prevent that, you must ensure that you have good iron salt and good hemoglobin to begin with. I often tell patients, if you have a hemoglobin of 13, even if you lose 5 grams of blood, you still have 8 grams. But if you were to start with 10 and you lose 5 grams, you are down to 5. So you are much at worst compared to other patients who start their labor with better hemoglobin. I strongly believe that a patient should ask questions. What is in place? What would you be giving me? And so on and so forth.
Being prepared is so important because you have options.
Really, there's a big variability from place to place and provider to provider. So I don't say that to make people frightened, but are they aware of these different both medical, pharmaceutical, clinical device interventions, and are they there? Place that she's planning on having her baby, do they have that stuff, and are they ready to use it?
TSA, tranexamic acid, is easily available. It has now become one of the essential drugs as listed in WHO essential drug list.
TXA is a medication which is magic. Actually, it's really magic, and I think pregnant women should know it, because whenever you are in conversation with your doctor, sometimes he's a human being. He can forget something. Then when you know something is there, you can, ask, oh, what about this? It's a conversation and it's your life. So you have the total right to express yourself. So TXA is not only stop bleeding, it has also a preventive effect, especially if you are delivering by C-section. That's a medication.
Cell salvage is a way of capturing your blood as it's lost during delivery, cleaning it, filtering, and giving it back to you. Your own blood is always going to be the best solution for your recovery. It's a simple process. It doesn't take much time or extra consideration, and it's very, very important, especially if you run into a bleeding problem.
I think this is the situation I would really advocate a lot. When a lady delivers, there is a sudden crash, there's blood loss, we need to quickly decide. And when we are talking about point of care, we're talking about acute situations, which are do and die situations where we need to take a call on a patient immediately. When we really have to manage a patient who's bleeding, the idea is not to buy time by giving more blood components, by giving more product, but to stop the bleeding. And to stop the bleeding, we must be able to understand what is causing primarily the bleeding in those situations. These point of care diagnostics help you pinpoint exactly this is the reason why there is a blood loss ongoing, and that is what an attending physician or a surgeon or another healthcare professional should be taking care of as a priority.
Delayed cord clamping is a gift, the first gift that we can give to a child from a mother at the moment a child is born. Because by delaying clamping the cord, we are ensuring that the baby gets as much blood as he or she can from the mother. And I'm glad to say that we have issued out as a Ministry of Health instructions that every hospital, every department should practice delay cord clamping unless in the exceptional cases where we can, where it is contraindicated.
Aside from what seems the very obvious dramatic intervention, medical, drug, device-related parts of managing a crisis, some are quite simple. Some of the cases that I have seen over the years, some that have turned out well and some that have not, are related to actually good nursing care, because that hemorrhage can happen after she's left the delivery room and, into the hours and days that follow. So I've seen both good and bad outcomes with nurses who were very much on their game and doing those real postpartum checks. Sometimes women are bleeding, they don't even know it. They don't even feel it. Is nursing care really on top of things? Good nursing care saves lives.
Without teamwork, we'll not save anyone. So to be able to save both of them, to be able to work efficiently, teamwork is key. Very, very key. Number one, top key.